Hello everyone, today's video is about brain mapping, the safe and sound protocol, neurofeedback, and some related topics. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if at some point you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a moment to do that. Still working from home, family members getting better every day, but still in the hospital. So still working from home, still casual mode, Dr. Raid, but should be hopefully back in the office within the next couple of weeks or so. So looking forward to that and having family member back at home and everything be right as rain again. So there were a couple of comments that were posted on one of my recent videos that was about brain mapping and neurofeedback and things like that. And so the one question was, it says, if neurofeedback hasn't been helpful in the past, do you think that the safe and sound protocol might not be helpful either, or are they different enough in how they work to make it worthwhile to give it a try? So really good question. For reference, safe and sound protocol, I have a couple of videos that I posted about that in months gone by. Go to my YouTube channel, keyword search that, you can find those videos. So it explains what that's all about. So they are quite different. And I mean, with neurofeedback, neurofeedback can be done in so many different ways. I mean, neurofeedback is neurofeedback, but the different protocols that can be worked with can be done in different ways. You know, some folks are using home treatment devices that are, can be very helpful, but they're limited in their capacity in terms of what kind of settings you can use, exactly where you can train the brain. There's only kind of limited areas where you can, say, put the sensors or whatnot that are, assessing certain parts of the brain during the neurofeedback process. When you're working with a clinician, there's different, software interfaces that are used. Some are better than others. There's different, treatment approaches. So there's neurofeedback is kind of like a beautiful thing in that it's very varied, but that's also maybe one of its detriments in that it's hard to kind of standardize it because there's so many different approaches. It's kind of like if you go to see, a functional medicine practitioner, whether it's a functional medical doctor, whether it's a naturopathic doctor, like you might find someone who just uses homeopathy and that's it. You might find someone who just uses pharmaceuticals and nothing else. Like there's such a spectrum, right? So the same thing with neurofeedback. So it's kind of a good thing, bad thing with neurofeedback. So with that being said, if neurofeedback was, categorically ineffective for an individual, would it be worthwhile to consider the safe and sound protocol? I think that it is still worthwhile because they are, well, the application to an individual person would really depend on their specific circumstances, but just speaking about it kind of theoretically, academically, just because neurofeedback didn't work for someone would not preclude them from trying the safe and sound protocol because they are working in different ways. The safe and sound protocol seems to largely be working on trying to push the vagus nerve into that ventral vagal state, that really kind of safe and sound, feeling well emotionally regulated, feeling more upbeat, feeling more connected, kind of pushing the nervous system into that mode. And then when we're in that mode, then we feel a lot better. We can probably, our nervous systems can regulate better, and that will probably have a spillover effect on helping to improve our neural networks. And indeed, I do have a small but growing number of patients who have done baseline brain maps, and then we just work with just work with the safe and sound protocol and nothing else. We don't do any neurofeedback. And then I'm having a growing number of patients who are having follow-up brain maps, and we're seeing significant improvements on those brain maps, and they're feeling better as well, which is always nice when the test results look better and the patient's feeling better as well. So it's nice when those two things line up. So I think that there's kind of spillover in terms of the net effects that we would see from both therapies, but they're both working through very different mechanisms. And actually I have some patients where I'll say, I think based on what's going on with you, based on your brain map, etc., we might actually just want to work with a safe and sound protocol because it seems like you need more of that vagus nerve regulation support, or that vagus nerve support, I should say, as opposed to just kind of retraining all these different brain regions. So they're therapies are quite different, and not responding to one would not preclude one from trying the other one. So thank you for the question. And then the next one here, so let's see here. It says, I think nervous system regulation is the number one skill to have for chronic illness and beyond, a skill to help yourself and your family members for the rest of your lives. Couldn't agree more. I'm curious, Dr. Reid, if healthy people would tend to have a normal EEG. So That's a great question, and I mean, it depends on what we define healthy as. If healthy is the absence of all symptoms, mental, emotional, physical, spiritual, beyond, then yes, they should have a perfectly balanced EEG or QEEG in this case, quantitative EEG. So yes. However, do we know many folks out there that fit that description? Hopefully they're out there. I know I'm striving to be that way. Many folks out there are, but have we achieved that? And so my understanding from, my mentors who have been doing brain mapping and neurofeedback far longer than me, who have been doing it, who have written textbooks on the topic, they talk about how, they've seen a couple of cases in their practice career where they've done enough neurofeedback where they have the perfect brain map, everything's green on brain map typically means looking good, or just everything's in perfect balance. So it can happen, but it's quite rare, and it takes a Herculean amount of effort in order to make that happen. But we don't need to get there. We don't need a perfect brain map to feel really good. Folks can feel, very, very well, and they still have some things that are a little bit off kilter with their brain map. So the goal isn't really to find a perfect brain map. It's more to use the brain map as a tool or as a guide to tell us, what do we need to work on? And then we can work with X, Y, or Z therapy, whether it's neurofeedback, safe and sound protocol, amygdala retraining, somatic experiencing, primal trust system, whatever it happens to be, cognitive behavioral therapy, what have you, EMDR, the list goes on, and then work with those therapies until the patient says, I feel good, or at least I feel good enough that I'm happy to, not keep on doing therapy or doing treatments or whatnot. But if by healthy person you mean just the average person who doesn't have complex chronic illness, maybe they get the occasional headache, the occasional little bit of gas and bloating, they're a bit stressed out at their job, they have a little bit of acrimony in some of their interpersonal relationships from time to time, but otherwise they're pretty blessed, health-wise on all levels. Otherwise, I would still expect them to have at least a little bit of imbalance on their QEEG. Probably wouldn't be anything very exciting, but there'd probably still be a little bit of imbalance going on. So I hope that answered the question. If not, please ask again or rephrase, and I will do my best to answer as best I can. Just the same person goes on to say, I found my EEG results, I'm assuming she means QEEG results, brain mapping results, to be invaluable from the 95% certainty of a traumatic brain injury. Yes, I had two, and that vagus nerve exercises with a TENS machine and diaphragmatic breathing would help. I think everyone should get an EEG, and totally agree with the Primal Trust program. Wonderful mix of exercises there to calm the stress response. So couldn't agree more. So thank you for saying all that. But she goes on to say, one last question. I'm in cell danger response, so I'm not tolerating methyl donors. Does the liposomal GABA contain theanine? Bearing in mind, she says here that theanine is a methyl donor. Would love to find a liposomal GABA that only contains GABA. So, great question. I have never come across a liposomal GABA that only contains GABA. There is a patented form or preparation of GABA called pharma GABA, which to my understanding is supposed to be much more bioavailable than standard GABA. I've only had a few patients who have worked with that. I've never actually prescribed it to anyone, just some patients come in on different things, and so some of them have found that pharma GABA has been helpful. I can definitely say from my clinical experience that liposomal GABA stands shoulders above standard GABA in terms of clinical usefulness and efficacy, but I do not have the same clinical experience to be able to say how pharma GABA stacks up. So I believe from the research literature it has been shown to be more bioavailable, but just because it shows that doesn't mean it actually works clinically. So I'm really not sure how it stacks up. I believe that there are pharma GABAs that are just GABA and there's no theanine in there, but I'm not 100% sure, but I believe that exists. So that's what I would probably try if it were me and I really wanted to avoid the theanine. What I will say is that with cell danger response, the proof's always in the pudding. If a patient's in cell danger responses, many of my patients are, and they seem to be sensitive to methyl donors, which many of them are, then we avoid methyl donors as best we can. However, I have many patients in cell danger response, and they do just fine with methyl donors. So just a general thought there that just because one's in CDR does not mean that they necessarily are going to react to methyl donors, even though on paper theoretically they should, and they should stay away from them. It does not always bear it in clinical practice. So just want to throw that out there. I hope this was of interest. If there's any other questions or comments, just post in the comment section below.